Hi, it's Dr. Jerome Fryer here, and today I want to talk to you a little bit about spinal instability. But first, gotta have my Italian leather jacket in a place where it deserves, on the anatomy. So, this here is a lumbopelvic model that I've created, casted from a real human specimen. It's interesting because this specimen actually had an osteophyte on this SI joint. So, and respectively, it created a bit of inflammation with this SI here. So, but I'm talking today a little bit about instability and what that means. Instability means unstable, and usually what happens is the disc loses a little bit of height, and when it loses a little bit of height due to the disruption of the hydraulics in the annulus, which is on the outer aspect of the annulus, is this white portion on the outer aspect here. You see a little fissure there, and this is the nucleus in the middle here. Well, when the annulus gets disrupted, the nucleus is not contained as eloquently in the center aspect of the annulus, so it moves around a little bit more, and when the disc height goes down, the disc is unstable. So this model here I created with a little bit different elastic properties associated with this annulus, and you can see that it moves more than the other levels. So when you bend forward, what happens is the facet joints become less engaged. Do you see that? The less engaged. So you rely more on the intervertebral disc hydraulics to support the weight. And there can be a little bit of shearing involved if you're not loaded in neutral or when the facets are engaged. Often another, pain generators can come from the disc itself, from the end plate, the interface between the disc and the vertebrae, innervated by the basivertebral nerve, which is this nerve here. And you can see the nerve that comes in through the back and innervates the end plates. The facet joints, you can see if you have a segment that's moving around too much, if it kind of slops around with motion, the facets actually will touch relative to the other ones. You see that? So if this slides around a little bit, the facets can become quite irritated and inflamed. So, the important thing is to try and do things to minimize height reduction of the disc. Prolonged sitting, anything in a static load will create compression of the disc. But most importantly is when you bend or when you create load or you lift something, you have to keep the spine in relative neutral, or this lumbar lordosis. So the curvature of the backs is important when you go to lift things, for example. Otherwise, if you go into a state of flexion and you go to lift something, this disc can slide around a little bit, just like that. It doesn't take much. Slides around a little bit, and it can cause irritation either the annulus, the end plate, or the facet joints. And sometimes even you can see the nerve roots that are exiting here that actually can bump into the nerve roots. So you have to be careful, and you just have to lift properly in lordosis. So that's instability in a nutshell.